And now it's time for The Doctor Is In.
Hi, I'm April Douglas for The Doctor Is In, and today our guest is Dr. Payne-Johnson with USA Health Family Medicine in partnership with Accordia Health. Hi, Dr. Payne-Johnson.
Hello.
All right, we're talking about something that's on everyone's mind these days, weight loss injectables, but there are actually some alternatives.
Absolutely. You know, now the latest craze is there's some natural ways to increase the same hormone, the GLP-1. And so, you know, teaching people how to eat a little bit different, like with lots of fiber, that would naturally increase GLP-1 is kind of the forefront.
Oh, good. So some things other than that, but your diet, which I've heard diet is 80%, exercise 20%.
That's right.
Okay, so we're on the mark. What should people do before they consider any type of journey to lose weight?
Definitely speak to their physician. And that way, the person that is looking at their lab work and knows them better can make initial suggestions. And so if they need to do something like medication, you want to get a full panel of labs first.
Now, what about, should patients come into your office and should they request medications, or
No.
how does that work?
Absolutely not. The best way to do it is actually to get a panel of labs and try diet and exercise first for about 3 months. And then if that's not successful, then you can go in and say, may I start something, or do you have any suggestions?
So, and you're going to help them. You're going to walk through this. You're going to tell them, here's the food choices you should be using. Talk to us. I'm coming into your office. What can I expect?
So you can expect that, you know, once I look at your labs, I'm going to decide, are you pre-diabetic? Are you diabetic? And definitely, like, do you have kidney disease? Because there's certain diets that we want to avoid. And then we'll make suggestions about things that they can add into their diet.
Good. So you'll hold our hand. You'll walk us through.
Absolutely.
But don't just come in asking for, we're hearing all about those.
Yeah, absolutely not.
But there are other remedies. You said medication is improving, though. There's lots of options.
We have a ton of oral meds, and then we've got some newer medications that should be out somewhere between the end of the year, early next year. So we've got plenty of options.
Are there any criteria are you seeing that we should be meeting for these, or you're going to help explain that to us?
Yes. So I typically will treat a patient with medication if their BMI is over 27. And there's BMI charts on the CDC website. And usually they have to have two like comorbid conditions. If their BMI is over 30, they don't necessarily have to have any comorbid conditions. But again, we definitely have parameters.
Lots of stuff and you're passionate about it. Visit Accordia Health, USA Family Medicine in partnership with Accordia Health for more.